What is intradialytic hypertension? Have you ever wondered why some patients experience a rise in blood pressure during dialysis? This condition is known as intradialytic hypertension. It occurs when blood pressure increases during or right after hemodialysis, which is surprising since dialysis usually helps lower blood pressure for those with end-stage renal disease. Intradialytic hypertension is defined as an increase in systolic blood pressure of more than 10 millimeters of mercury during the dialysis session. Some patients may also see a rise in mean arterial pressure or any increase in blood pressure during dialysis. This condition affects about 15 to 30% of patients undergoing hemodialysis. Why is this important? Well, intradialytic hypertension is linked to higher risks of hospitalization, cardiovascular events, and even mortality. It serves as a marker for cardiovascular risk and vascular stiffness in these patients. So, what causes this rise in blood pressure? There are several factors at play. One major contributor is volume overload. Many patients retain excess fluid and sodium, leading to increased blood volume. If dialysis does not remove enough fluid, this overload can cause blood pressure to rise during treatment. Another factor is increased peripheral vascular resistance. This means that the blood vessels are constricted, making it harder for blood to flow. Elevated levels of endothelin-1, a strong vasoconstrictor, can lead to this issue. When there is an imbalance between endothelin-1 and nitric oxide, which helps dilate blood vessels, blood pressure can spike. Cardiac factors also play a role. If the heart is pumping more due to volume status or other issues, this can contribute to higher blood pressure. Additionally, older age, lower serum albumin levels, and taking multiple antihypertensive medications can increase the risk of intradialytic hypertension. Managing hypertension during dialysis is essential. Addressing intradialytic hypertension can complicate blood pressure control for patients with kidney disease. Practical steps include carefully assessing dry weight to avoid fluid overload and optimizing ultrafiltration rates during dialysis. Adjusting antihypertensive medications may also be necessary to counteract the effects of vasoconstriction and endothelial dysfunction. In summary, intradialytic hypertension is a rise in blood pressure during hemodialysis caused by a mix of volume overload, vascular resistance, and cardiac factors. It indicates a higher cardiovascular risk and needs careful management to improve health outcomes for patients undergoing dialysis.